Dr. Kristen Jacobs from Ooh La La Spa, Anti-Aging and Wellness in Glen Carbon, Illinois, and welcome to our live show today. I know we have so many people watching because they want to know who is going to win the Diamond Glow, but we're going to keep you in suspense a little longer because we're going to do our show and then we'll announce it at the end. So today is the Diamond Glow Day, and it is just going so well. We have so many new patients that came in to try it. Every single one of them just loves it. So if you're watching and you didn't get your appointment for today, you can still give us a call and do the same special. We're going to honor it because we were full so fast. We're going to honor it through next week, and I think the first week of March, because I think next week is actually already full as well. So that special was you do a $100 reservation fee, and when you buy 3 SkinMedica products, you get your Diamond Glow, which is a $200 value. You get it for free. So it's a really good deal. And I had one of my good friends yesterday came into the office and she said, I just did it. I just knew it was a great deal, so I just did it. And so she said I didn't even know what it was. I just did it. So anyway, so she loved the treatment, and we all have just absolutely loved it. So you can still do that. And at the end, we will announce our winners. So thank you for liking, sharing, commenting. And I mean, this was so exciting for us to see how many people are really interested in this treatment and doing something for themselves, which we all deserve. So today we decided that we're going to do Botox because I have movement on my forehead and I look in the mirror and I think, oh, holy cow, this is not right. So I hate to even show it. It's hideous.
Let me zoom in.
I'm so ugly. I need my Botox. So I asked Taylor, so we made a deal. If she does mine, I'll do hers. So you get to see both of us get our Botox today. I keep holding this because I didn't want to forget to talk about it. I am sporting our new Color Science Balm, I think it's called. Is that what it's called, Steph? It's a color balm, and this is the blush. This is a tester, so yeah, I think the color is blush, and I have it on my cheeks, and I actually just put it on my lips. And you can use it on the eyes. I didn't use it on my eyes this morning because I forgot that you can use it on the eyes. But I wanted to make sure that I showed this. And it actually is very hydrating on the lips. I like it a lot. It comes in a berry color and it comes in a bronzer, which we're going to get for Taylor because she was talking about bronzers this morning and how she hasn't found one that she absolutely loves. So we're going to get that for her and she'll try it on for us one day.
Yeah.
We just placed our order, so all of this will be in next week. So, okay, so that's what I want to talk about. Will you just stick that back there, please? And then we're going to do Botox. So, your March email that's coming out has information about Botox and about how TNS and Botox pair so beautifully together. TNS Essential Serum is our serum that we use that helps to stimulate collagen, helps with fine lines and wrinkles. So when you pair the two of them together, you're going to have even better results. And eventually your Botox will last a little longer. What's interesting, and I'll do all the movements for you, is that Taylor said it's been exactly 3 months since I've had my Botox. Really, my forehead is what's driving me crazy, and then just this part of my crow's feet. The rest of it's actually not too bad. And this isn't moving, and I think this lasts a little longer than the 3 months. So really, we tell everybody 3 to 4 months with Botox, but because I use all of our SkinMedica products and our Color Science products, I do feel like the lines stay away a little bit longer. So if you're not on our email list and you want to be on our email list, we send an email out once a month, and it just talks about a service, a product, and we have a blog that we write, and it's just very informational. And if you have any questions, then a lot of times they're answered in that email. And I absolutely love putting them together because we like to just talk about all the different services and the products that we have. So, shall we do it?
Yes.
Okay.
I'll lean you back a little bit.
Okay, so the 3 areas that we mainly do, are you doing my chin too? Okay, is we do, most people do glabella, they do crow's feet, and then we do forehead. We're gonna add on my chin today because of the orange peel. How's it looking?
Not bad.
Not bad? Okay.
No.
This part drives me crazy, so we put a little bit of Botox there. So the FDA has approved these 3 areas that I mentioned first. Those are what they have clearance for. And so the majority of people are about 24 units in here. Because I've been doing mine for 12 years and I don't have many lines there, I only do 15 units. So that's the beauty of Botox, is that you can cater to everybody's needs. You don't have to just throw some Botox in and everybody does the same amount. So again, I only do 15 here. So with me, and I think you do too, right?
I do too.
She's like a lot younger, so that's why she does it. I've been doing it long enough, that's why I only do the 15. The forehead, it's indicated to do 20 units. Usually my average person is more like 10 to 12, maybe 14. I don't know, what are we doing today? 12 units, okay. And then around the crow's feet, the average is 24. So when you add all of that up, it's over 60 units. And by adding this, I do over 70 units. And everybody thinks, oh my gosh, that's so much. But really, that's what a complete treatment is. Now, hers is a little less because, again, she's more prevention. I'm more correction. So you'll see, I don't remember how many units, but
I do 25. So I do 15 and 10 on my forehead.
Okay, and we don't do crow's feet. No, she's very good about using all of her products, and so we're preventing it that way. You know, maybe eventually she'll want to do it. Smile for me. She has a little bit of lines, so if she wanted, again, it's more prevention than treating because, you know, they're not bad by any means. And this is what we talk about in a consultation when you come in, and we just talk about what bothers you and then how we can treat it and how we can maintain it, because it's silly to come in and do Botox one time, in my opinion.
Yeah.
I mean, you could try it. If you don't like it, who doesn't like it, then you don't ever have to do it again, and you're not going to be like backwards, it's not going to be worse or anything like that. But the majority of patients who come in absolutely love it. So, okay, I'll stop talking.
Ready?
Now.
Okay.
I think
Do you
so.
want the pillow or are you okay with that?
I'm okay without it.
Okay,
So,
keep your legs up.
no, I think I'm okay.
Okay.
Yeah. So I'm a big baby, and so I don't love getting Botox, but really we use a teeny tiny little needle, and it doesn't hurt. And most of the time Taylor does such an amazing job because she knows her job depends on it, right? Right. Okay. And I barely felt that, so that's good. And so what she's doing is injecting 5 units in there.
Okay, and furrow like you're mad. Alrighty, and relax.
And then she'll do 5 in here. And most people will get 5 little injections in here, but as I said, since I've been doing this so long, I really only need the 3, and that didn't hurt at all. Good. And so another 5 in there. Good. And a lot of patients are extremely anxious when they are doing this for the first time, and every single one of them says, oh my gosh, I was anxious for nothing. You really can't feel it at all. I've never had anybody who said, oh my gosh, that was the worst thing ever. I mean, I don't love it, but I'm going to do it because I love the results.
The results are amazing.
Yeah.
Can you turn towards me a little bit more and raise your brows really high? And relax.
And so with this one, she's going to do 2 units in each little injection point. And like I didn't feel that one at all. And some you feel more than others. I think the crow's feet you feel a little bit more, and for some reason, like I absolutely hate when she injects my chin, and it's such a big fat muscle that you shouldn't really feel anything, but for some reason I do. I don't know why.
Raise again. Okay.
And I have a very thin frontalis muscle, which is what she's injecting right now. So that's why we don't do a whole lot, because you don't want to droop the eyebrows down. So patients who have had drooping of their eyebrows, it's because there's too much Botox in that forehead muscle.
Last time.
And it's a misconception that if you inject up here, it's going to lift. That's not what lifts. This area is what lifts. This area relaxes, so you can't really raise your eyebrows. But as you can see, and I still have facial movement, and it's been 3 months, so my Botox on my forehead, I would say, is completely worn off. Okay, wink. Okay. Oh, wink.
Yes.
So we're getting a little lateral lift, but really the other reason to do this is to get the lower forehead lines too. So we'll have it's double duty here. Okay.
Okay, now we're gonna do crow's feet.
Awesome.
Smile big and relax.
And this is the one that I was seeing come back. And actually, I always dread my crow's feet, but that really wasn't bad at all.
Good. Smile again. Okay.
think Taylor's just really good. Yes, she's a professional. So around my eyes, are we doing 30?
We are doing, last time we just did 16, 8 and 8.
Oh, is that what we're doing?
Yeah.
Okay, well that's good.
Smile again. I feel like you don't need much. I mean, you have a little more movement up here, but.
Okay, I'm good with that. Okay. And again, that's the beauty of Botox is that you can add, you don't have to do as much. And for 3 months, I mean, I probably did 30 units for, I don't know, 10 years.
And maybe we didn't do as much last time because you did a touch up in between. Maybe.
Oh, maybe.
Oh no. Okay.
I don't like any movement, so.
Turn like, yeah.
And what I love about Botox is it just instantly perks you up. And so it's not, like nobody's gonna know I had it, and that's the purpose. We don't want people to look at you and go, what'd you do?
Yeah.
You know, we really want people to just you look refreshed. Okay, I hate this squeeze hard.
I'm just trying to do it while you are talking.
Bad. Not bad. And then my other favorite area to do Botox is under my arms, and I don't know when the last time I did that, but I usually do it anywhere from, I think 9 to 12 months is what we do.
It's been a while.
After that, yeah, I think it's been a while too, and I literally have not worn deodorant since I started doing this like 3 years ago. So I really loved having the underarms done so that I'm not so sweaty. So, okay, so we're going to flip-flop it. I'm going to do Taylor's. Here you go. Thank you, ma'am. And you got yourself pulled up?
I do, yeah.
You do? Oh, okay. And so we're doing... What'd you tell me? What am I doing? Oh, because we're doing your jaw. Yeah.
15,
okay.
10, and 25.
Like, why do we have so much? So, okay. I'm going to be really frozen. You do. No. Okay. Do you want the pillow?
Yeah.
Okay. And I can set you up a little if you
Yeah.
want. Better. Okay, good.
Yes.
Okay, what is it? 15?
Mm-hmm.
Okay. And what? 10. Okay. We'll do this. We're going to do something a little different on Taylor, too. She's been having some, is it jaw pain? Is that what you're doing?
I just clench really bad at nighttime, and so it's causing jaw pain and headaches, tension headaches.
And we did a little bit last time, but it wasn't quite enough, so we're going to do a little bit more. So again, 15 units here, 5, 5, 5. Very good. See, she doesn't flinch at all. She's not nearly as much of a baby as I am. Good, lift and relax. And believe it or not, I mean, your forehead is not
No, it's not bad at all.
terrible.
Yeah, when I used to raise my brows and then relax, you could see the line still, and my Botox would wear off, but it's definitely...
It's improved, and again, that's your skincare. It's keeping up with the Botox. I know you did a diamond glow not too long ago. So keeping up with doing some in-house treatments. Okay, so 25. Okay, so what we're gonna do, go ahead and clench down.
Can you stay clenched?
Yeah, clench again. And here we go. Did you feel like you had any change?
I do feel like it helped a little bit.
Okay.
It just, it wasn't totally gone.
Okay. Okay. And one more time. Okay, good. So this is her masseter muscle, and it's a big one, and it's thick, and it's her jawline basically, and so that's why we need to inject a little bit more than we would in other areas. Okay, clench. Clench. This one's not as strong as the other side. Clench again. And
And you can do this too to like slim out the face, can't you?
You can, and I actually should do it because I have a very strong jawline. Hello.
Get out of the way.
Yeah, excuse me. This is all about me. But I'm very square, and so it would help to thin that out. I mean, and not that you need any thinning out. You have a good
pretty square, but
you're not bad. Okay, so that's Botox. And we always talk about our fountain club and the membership program, and the way to save money on your Botox treatments is to do the fountain club, which means you pay monthly for the amount of Botox that you do, and then when you come in, thanks Tate.
Thank you.
And then when you come in for your treatment, your Botox is completely paid for. So our patients are loving that. We have over 200 members of our fountain club. They're doing some kind of service, but the majority are doing Botox. It really is a great way to budget out your money, figure out what you need, and get a great discount on it. And we do the same thing with our TNS Essential Serum. Thank you so much. And this is what I'm talking about. Oops. It's just the light. You have another one? Okay, this is, we use our testers, so that's a good thing. But the TNS has a red and a white side, and the red is the growth factors, and the white has antioxidants, peptides, and a lightening agent. So I may as well just rub it on in to my hands. But anyway, you can do the same things. It work? Cool, thanks. You can do the same thing. There we go. There's your red, and I guess it's more of a cream side. But you can do the same thing with the skincare, is that you pay monthly. Stephanie, if you could see her right now, she is back there just rubbing it everywhere, which is what we have to do because we're not going to waste it. But anyway, you can get the backs of your hands. But you do this in a monthly subscription as well, because then it takes the payments down and you can, again, budget it out. So that depends, the price depends on if you're doing this twice a day or once a day. It's indicated for twice a day, but some people do it once a day because they're not as good maybe with their evening routine or their morning. Some people work in the morning. So this to me is an absolute positive must-have. Every single person should be on this, because not only are you getting the growth factors to stimulate collagen, but you're getting the antioxidants, the peptides, all the things that we need to continue on that anti-aging pathway. The great news is that the new one is on its way. We should have it by April. So I am actually heading out to California to a Skin Medica event. I think it's next weekend, and I'm really hoping that they're going to give us some so that I can bring it back and show everybody. And you're supposed to be able to see results within 2 to 3 weeks. All of their newer products, we've been seeing skin changes as early as 2 to 3 weeks. So I know that the new one is going to tighten up the skin, and you'll see results within 2 weeks. So, I mean, you can't, in my opinion, when you're doing anti-aging, I can't live without my growth factors, and I can't live without my Botox. So then we, with our new Diamond Glow, I think that's an excellent, ooh, so sorry, I just dropped the TNS. But the Diamond Glow is an excellent monthly service to do, because it's exfoliating, it's extracting all the bad stuff out of your pores, and then it's hydrating. So that one, you can also do in a membership, and that one is an excellent way to start down this road, because it's not invasive, you're not going to have any downtime, and your skin's going to look amazing. So, well, that's, and I think I said earlier, if you want to join our email list, just shoot your email to us. You can put it under the video, or certainly just send it private message if you don't want to put your email out there, because, who wants to put emails out there. So Steph's going to hand me the name of the people. So again, the person, I really appreciate all of the love that we received, and because you did such an amazing job last time, we decided, we got it on both sides, we decided that we want to continue to do this. And so this time, we think we should give away 20 units of Botox. So it can be to our established patients if you want. It can be to a new patient. Just do the same thing you did last time. Like, share, comment. 20 units of Botox will get you your glabella treated if it's not too bad. Potentially your crow's feet. So you may need a little bit more, but it's an excellent start. So again, if you want to get in on that, like, share, comment, and next week we will announce who wins the Botox. So today, the winner of the Diamond Glow is Elisa Goodman. So we cannot wait to see you. What's that? I'm sorry.
I'll message her.
Oh, Steph's gonna message you, and what we will do too is when you call in, obviously they will know who it is, and you'll come in, you'll do your complimentary consultation along with this, because what we do when we see anybody is we want to see what your skin is like. We want to look underneath the surface. We can see the red spots, the brown spots. We can actually see the true age of your skin. So when you come in, we wash your face, we take a bunch of photos, which is not everybody's favorite thing to do, but again, we're trying to see what's happening underneath that, the surface of the skin. And then we do whatever consultation, we create a treatment plan, we do your treatment, and then we put our color science on after that, because we don't want to send you out in the world without your sun protection. And it's sun protection, but I wear it as my makeup every single day. And as you saw, my new little blush stick and my lipstick. I think that when you're talking about aging, you have to talk about healthy skin, and color science is the finishing touch, is what we call it, for healthy skin. So we will, if you have any questions about this one, don't hesitate to give us a call, ask us questions on here. Again, my favorite, all of these things are my favorite, but Botox is something that I don't know what I would do without. So thank you so much for watching again. And like, share, comment, send it to your friends, and give us a call if you have any questions, 618-288-9117.